Hi, my name is Dr. Sive Gallagher. I'm a plastic and reconstructive surgeon based here in Miami, Florida. And in this video, I'm going to talk about facial masculinization. Now, we've all heard of facial feminization, and that is a much more common procedure. Typically, folks who transition, who are assigned female at birth, oftentimes it's believed that testosterone could do a lot to help, and the beard can also do a lot to help. So this tends to be one of the less asked for procedures in the past. However, I am noticing that is changing regardless of whatever gender folks are assigned at birth. So the first thing to know about facial masculinization, it's certainly not one size fits all. It really depends on what the goals of the individual patients are. Typically, if a patient is over 35, we might be doing some anti-aging things when we're there as well, but it really just depends on what the individual patient wants to do. However, there are some things that we very commonly do in folks who are seeking facial masculinization, and by far the most common area we treat is the jaw and chin. So in general, and I shouldn't really generalize like this, but in facial feminization surgery, we're oftentimes making structures smaller, and in facial masculinization surgery, we're oftentimes enlarging or enhancing structures, like, for example, the entire jawline. So one thing that can make a huge difference, that's very subtle, first of all, is addressing the chin. So typically in folks who are assigned female at birth, the width of the chin is usually the same as what we call the intercanthal distance, so the distance between the two eyes, whereas a more masculine appearance would be when the edges of the chin line up with the edges of the mouth, and that is something we can certainly achieve. Usually when we're doing chin enhancement, we're projecting that chin and improving the profile as well. And same thing goes for the rest of the jaw. The next thing we'll usually address is what's called the angle of the jaw. In a masculinized face, we want to see a more chiseled, angle of the jaw over here, and we can achieve that by putting something in there. Now, what do we put in there? So there's a few different things we can put in there to achieve facial masculinization, and this would be the most simple one: filler. Usually this is your entry-level facial masculinization. What I really like about filler is it's quick and easy, it's done awake. The patient can weigh in on the results while they're there, while you're working on them, because you're not asleep. And then worst case scenario, thankfully I've never had this happen, but if the patient hates the results, it can be dissolved. So it is completely reversible. The downside is it usually only lasts about 6 months, usually, depending on the product you use. Some of them can be longer lasting. So the more permanent solution in order to augment the jawline and do facial masculinization would be implants. There are a range of different implants available. Just chin implants, we oftentimes do those at the same time as top surgery. It's a relatively quick and easy procedure versus angle of the mandible implants, and there's actually full wraparound implants as well, just depending on what the patient's needs are. I think it's a really good idea to talk to your plastic surgeon, maybe do some fillers, see if you like the look, get used to your new look, and decide from there. But lots of different options are available. Sometimes we'll also address the cheeks, and Botox can also masculinize the face in different ways as well. I hope this helps, and follow and like, share, and subscribe.